Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD. We are almost at the end of our Super Mama Summer series because it's fall, y'all. But there's something that I thought was really important, and that is learning how to do postpartum like a pro. So make sure you keep watching for tips and tricks. Girl gang, so let's jump right into this series of videos on how to do postpartum like a pro. So I really want to start out right at the beginning of the postpartum period because I think that's really important for women to understand what to expect in those first couple of days. And so we've talked a little bit in our last videos about breastfeeding and skin to skin, but what happens after that? That's something that we really want to go over in this next couple of videos. And the postpartum period can be really difficult for women of all ages, regardless of if this is your first baby or not, or if it's, a baby, number 3 or 4. So I want to make sure that you guys have these tips to just kind of set yourself up for success. So tip number 1 is going to be educate yourself about the postpartum period. And so nowadays, most hospitals should be doing what we call rooming in. And that means that your baby is rooming in with you for the few days that you're in the hospital and only going to the nursery if they need to see the pediatrician or have some sort of lab work done, hearing test, or that sort of thing. And most of these things can really be done at the bedside. A lot of pediatricians these days are actually coming to the room with the mom and the baby and seeing the baby. I know at my hospital, my pediatrician and I are often in the room at the same time, and I'm checking on mom and they're checking on the baby, and we're able to actually answer questions together, which is really helpful. Since your baby will have its own pediatrician while you're in the hospital, and then you will start taking your baby to your pediatrician of choice once the baby has been discharged home. So I get a lot of questions from moms who are wondering if they should send their baby to the nursery so that they can get rest. And certainly that is an option if you need to just get some uninterrupted sleep. You can ask for the baby to be sent to the nursery, but especially if you are breastfeeding, I think it's very important that you do those feedings as the baby demands it. So we do what's called on-cue feeding. So when we see feeding cues, we really want you to try to put the baby to the breast, or if you're deciding to pump, that you pump at the opportunities every 2 to 3 hours that you have to breastfeed. So I think rooming in is a big deal, and I think it's very helpful to help promote good bonding and breastfeeding. But if you find yourself at a place where you are just absolutely exhausted and you're worried that you won't wake up to hear the baby or that you're going to be missing some of those feeding cues, I think it's totally acceptable to inquire about having a 2-hour or 3-hour nap so that the baby is being watched. And honestly, my preference is that the partner, that your partner who's there watches the baby and actually keeps them skin to skin and just kind of make sure that they're doing okay so you can get some rest. I think it's really important to mimic what's going to happen at home while you're in the hospital, because I think there's a huge culture shock from going to the hospital where there are doctors and nurses and lactation consultants and other people who can help you, and then you get home and all of that is suddenly taken away. So I think it's important to try to mimic the experience at the hospital as much as possible for what will be happening when you're home. So prior to you going home, your baby will have a few tests that it will need to have. There's some blood work that's pretty much mandated by the state, but I want to always be very clear with my patients that they don't have to do anything that they don't think that they want done for their baby. So this can be things like the hepatitis B vaccination. I get a lot of questions about that. We usually like to give the vitamin K injection, and frankly, I usually always push for vitamin K injections for babies because that really helps to clot their blood in the event that there is an injury to the baby, or that there are blood vessels in the brain that are still forming, that are not as strong as they're going to be yet. It helps prevent bleeding, especially brain bleeds. And so vitamin K injection is really important. I would talk to your pediatrician of choice about the hepatitis vaccine. I get a lot of questions about that, and I've even asked a lot of questions about that. And so, my opinion is that that's something that I leave up to the mom and to her pediatrician of choice. Hepatitis B has been something that we've given during the newborn period, but I once had a mom that asked me, how do people get hepatitis B? And really, people get hepatitis B from sexual intercourse, from blood transfusions, and also certainly from IV drug abuse. And the mom said, well, my baby's not using IV drugs. It's 2 days old, and my baby is not having sex, and my baby, does not require a blood transfusion. So what's the point of me doing this? And honestly, y'all, I didn't have a really good answer for her. So I asked her to talk to her pediatrician about it, and I talked to several pediatricians that I work with and no one really had a great answer for it. So, when you run across things like this, you really want to be thoughtful about what you're doing. And I think that vaccines are a great idea. I don't necessarily know that we have to use them exactly on the schedule that we use them on. In terms of vaccinations for mamas, we often try to offer the whooping cough or Tdap vaccine between 28 and 36 weeks. But for those women who aren't comfortable with that or maybe miss that window, we will certainly offer it in the postpartum period. So that's something that we definitely recommend, as well as for those folks who are close in your household, like grandparents or partners who are going to be taking care of the baby with you closely. We really like that Tdap or whooping cough vaccine because it really prevents whooping cough in babies. And while when we get whooping cough as adults, it can be a mild kind of upper respiratory illness. For babies, it can be absolutely devastating. So I really recommend the Tdap vaccine to parents and to anyone who's going to be taking close care of that baby, just to help guard against that, especially if you're having your baby during cold and flu season. In addition, we offer the flu vaccination for mamas. I highly recommend the flu vaccine, especially this year. It's 2020, and we know that we're in the middle of a coronavirus pandemic. So if you're offered that postpartum or just did not get it for some reason during your pregnancy, I would definitely recommend taking that. And finally, if you have an Rh negative blood type, such as A negative, B negative, AB negative, or O negative, you want to ensure that you have had your RhoGAM back prior to leaving the hospital if you have given birth to a baby who is found to have a positive Rh type. So that would be A positive, B positive, AB positive, or O positive. And that simply helps to guard against you making antibodies or proteins that could attack your next baby's blood. So many times you may have a mom and a dad who have different blood types. And if the mom has an Rh negative blood type and the dad has an Rh positive blood type, the likelihood of your baby being Rh positive is pretty high. If you know that your partner is Rh negative, you should not be at risk, but we should certainly confirm those blood types, because once you have made antibodies against the Rh positive protein on red blood cells, if you become pregnant with a baby that's Rh positive, your antibodies could attack their red blood cells, and it's just badness. So we don't want to chance that. Even if you're having bleeding during your pregnancy or very early on in your pregnancy and you are Rh negative, we recommend that you get the RhoGAM, because it won't hurt you, but it will certainly help you if you happen to become pregnant with an Rh positive baby. 2, understand that babies cry. Babies are going to cry sometimes for absolutely no reason. Maybe you have changed their diaper, maybe they are fully fed, and sometimes they're still crying. This can indicate that they may have some gassiness going on. And I'm going to link in the description box some really good baby yoga videos and tummy massages that you can do to help with that. Sometimes they're just irritable. Newborns are used to being in a very quiet place where it's very low lighting, it's dark. They are used to being in water and not necessarily feeling the weight of gravity on their body. So sometimes swaddling can help when they're crying and you're not sure why. In addition, skin to skin is fantastic. So if your baby's really upset and fussy and you know that they've been fed and you know that they've been changed, sometimes just taking your shirt off or having your partner take their shirt off and put the baby skin to skin can be really magical in getting them to calm down and go to sleep. But if your baby is crying unconsolably and you've tried to do all of the measures to help them, then I would definitely seek some guidance from your pediatrician just to make sure that there's not something going on that you need to be aware of. Plan for pediatric care in advance. I usually encourage my moms at about 28 weeks to start looking around the community to see who they feel comfortable with as a pediatrician. And you can ask friends or family members, you can look at reviews online, you can go in and actually ask to meet the pediatrician and their staff. And I think that's a really important decision that you want to make. You want to make this before you actually go in and have your baby, because we want to be able to make sure all that information that we've collected in the medical record for your birth and all of the information that has been collected about your baby during their hospital stay gets passed on to that pediatrician, and that you have an appointment to see your pediatrician within a few days of your baby being born so that they can make sure that they're doing what are called well baby checks. My final tip is to plan for success. Taking your baby home can be a challenge for any new parent, even if it's not your first child. So making sure that you have a plan so that you can get adequate rest and support is absolutely key. Absolutely key. So we want to make sure that you have a plan for who is going to be there to really assist you as you bring your new baby home. Folks can help by bringing meals. They can help by helping with laundry and cleaning. Also by just coming over and being available to help take care of the baby if you need a nap or if you just need some downtime. So I really encourage my moms to kind of start a list of things that need to get done, the absolute important items that need to happen in your household, and to start assigning that list to people who are in your support group. Hope you enjoyed this video. Make sure you are subscribed and that you like this video if it was helpful for you. And we'll catch you next time, Girl Gang. Peace.